This is Sarah King, and this presentation is on big data and considerations for proper use of this technology. So, what is big data? Big data is defined by the National Institute of Standards and Technology as the large amount of data in the network digitized, sensor laden, information driven world. While opportunities exist with big data, the data can overwhelm traditional technical approaches, and the growth of data is outpacing scientific and technological advances in data analytics. With the digitization of society and rise of social media, the availability of mass amounts of data has increased exponentially. This is evident in the healthcare sector as well, with the conversion of many healthcare organizations to electronic health records. Companies began using the increased available personal data for targeted advertising, such as the Facebook ads that pop up on news feeds. And this seems to be one of the most well-known uses of big data in the general community. As you can see, the availability of big data has implications for a variety of sectors. I can speak more specifically to the use of big data in the healthcare sector. Healthcare organizations use big data in population health to build registries. Having a registry assists in the evaluation of trends and best practices. For example, a registry of all patients with colon cancer can help identify patterns that may assist with disease prevention and/or management. These data elements can then be used within electronic health record systems for clinical decision support by flagging healthcare practitioners when patients who meet certain criteria may need to be screened. Registries also help identify epidemics and pandemics, such as COVID-19, more quickly. In my previous role at a healthcare system, I was responsible for capacity planning in outpatient clinics. I used our business intelligence systems to identify peak times for late cancellations and no-shows, and our organization strategically shifted overbooking of appointments to days and times that were more likely to have a cancellation or a no-show. This allowed our providers to increase capacity and offer more access to care with decreased lead times while reducing the impact to clinic flow. We also used a predictive analytic model to identify patients who late canceled and/or no-showed greater than 80% of the time on more than 5 appointments, and strategically placed those appointments without impacting patient care or provider schedules. This enabled us to increase access to health care with limited resources. So why does big data matter? I touched on big data in healthcare on my previous slide, so I want to delve into how big data was used for emergency response during COVID-19. This diagram covers several major areas where big data was or could potentially be used for pandemic response, depending on the organization. One area that I don't see covered in this graphic is surge planning, and I would like to add a little more information about how that worked at my organization. During the pandemic, we used predictive modeling to evaluate when we thought cases would peak and made surge plans that included staffing, reducing elective procedures, discharge planning, PPE, and unit/bed analysis. So one example of that was moving the COVID unit to an area with more beds. Having data available enabled hospitals to be better prepared for increased patient volumes.